Then the test for the acetaminophen or the paracetamol is the O-cresol or ammonia test. Paracetamol is a widely used analgesic and sometimes occur in combination with other drugs such as dextropropoxyphen. It is a metabolite of phenacetine and binorelate. It is largely metabolized by conjugation with the glucuronic acid and sulfate prior to urinary excretion. Hydrolysis of gluconate and sulfate conjugate with the concentrated hydrochloric acid gives para-aminophenol, which can be conjugated with O-cresol to form the strongly colored dye, thus giving a sensitive qualitative taste. This is the basic principle behind the color taste for the paracetamol poisoning. So, the reagent used for this taste are the concentrated hydrochloric acid, aqueous O-cresol solution and aqueous ammonium hydroxide solution. To perform the test, add 0.5 ml of the hydrochloric acid to 0.5 ml of the sample. Then boil it for 10 minutes and then let it to cool down. Then add 1 ml of the O-cresol solution to 0.2 ml of the hydroxylate that has been created and 2 ml of the ammonium hydroxide solution and mix it for 5 seconds. A strong royal blue color developing immediately indicates the presence of paracetamol. As you can see in the picture, this is a blank urine and this is the urine containing paracetamol that gives the royal blue color to the test sample. This test is very sensitive and will detect therapeutic doses with the paracetamol even up to 24 to 48 hours. Only aromatic amines such as aniline, which also give rise to para-aminophenol in urine after the hydrolysis, are known to interfere with the result. Ethylene diamine from the aminophyllene gives the green color with this test. Then Dithionite test is performed for paraquat and diquat compounds. Paraquat is a widely used contact herbicide and may be formulated together with related herbicide paraquat. Paraquat is often encountered as the dichloride and is extremely poisonous. The lethal dose of paraquat in an adult may be as low as 4 mg per kg of the body weight. Paraquat and diquat give the highly colored products with the sodium dithionate, and this reaction forms the basis of the color taste for the paraquat and diquat compounds. The reagents used for the color taste are sodium dithionate, that is in the solid form stored in the desiccator, and another reagent is the aqueous ammonium hydroxide. As paraquat is very toxic and may be absorbed through the skin, so all the precautions shall be taken to handle the items containing the paraquat. Test is performed by adding 0.5 ml of the ammonium hydroxide solution to 1 ml of the test solution and the other tubes that is containing the blank and the positive test. Then add about 20 mg of the sodium dithionate to each tube and mix it. If any color forms in the test solution, agitate in air for several minutes. It will allow the color to be disappeared due to some unwanted contaminants. A blue or blue-black color indicates the presence of paraquat compound. The related herbicide diquat gives a yellow or the yellow-green color. As may be seen in the picture, this is a blank urine sample. Then this is the positive test sample that gives the slightly bluish hue, that is indicative of the paraquat compound. Then this is the strong positive for the paraquat, that is the test containing the paraquat as a chemical. Then this is the slightly yellowish color, so this is for the diquat compound. If the color fades on continued agitation in air, paraquat or diquat is confirmed. The original color can be restored by adding more sodium dithionate. The qualitative color test that is described in this picture is to detect for the volatile reducing agents. Acute poisoning with ethanol is very frequently encountered in hospital admissions and is usually the result of ingestion of alcoholic drinks. Poisoning with industrial alcohol, that is the methylated spirit containing various denaturants, notably methanol, also occurs. So the qualitative test is done with a reagent potassium dichromate in aqueous sulfuric acid. To perform this test, about 50 microliter of potassium dichromate solution is added over to a strip of glass fiber filter paper, and this glass fiber filter paper is inserted in the neck of the tube containing 1 ml of the test sample. Lightly stopper the tube and place in the boiling water bath for the 2 minutes. A change in color from orange to green indicates the presence of volatile reducing agents such as ethanol. So here in the picture you can see that the color change is not occurring. That means this doesn't contain the ethanol compound. Metaldehyde, methanol and paraldehyde may also give positive result in this test. Then color test for the iron. Ferrous salts are used in the treatment of iron deficiency anemia, and ferric salts, which are more toxic, have been used as abortifacients. The minimum lethal dose of ferrous sulfate in an adult is of the order of 30 grams, but 1 gram may be dangerous in an infant. A green or the blue color in the vomit or stomach content suggests the presence of iron or the copper compound. The qualitative test can be used to differentiate between the ferrous and the ferric iron and other metals, while the quantitative assay can be used to measure the serum iron. It is important to avoid contamination when collecting blood for measurement of the serum iron concentration. Vigorous discharge of the sample through the syringe needle can cause sufficient hemolysis to invalidate the assay. That can cause a spuriously rise in the level of the iron. To perform the color test, aqueous hydrochloric acid, aqueous potassium ferricyanide and aqueous potassium ferrocyanide solution is used. Test is performed by adding about 0.1 ml of the dilute hydrochloric acid and 0.05 ml of the potassium ferricyanide solution to 0.1 ml of the test sample, and then it is allowed to vortex mix for 5 seconds. Then leave the sample for 5 minutes at the ambient temperature and then centrifuge it for 5 minutes. Deep blue precipitates with potassium ferricyanide indicates the presence of ferrous form of iron, that is ferrous salt that contains Fe+2. So with the ferricyanide, potassium ferricyanide, it will detect the ferrous iron. As you can see in the picture, this is the blank, that is not giving any blue color, and the sample containing the ferrous form of the iron. So the potassium ferricyanide along with the hydrochloric acid added as mentioned in the method, then it will give the bluish color. And when the potassium ferrocyanide is used, and then if it is giving the blue color, that means the compound is the ferric iron. So in this way we can distinguish the ferrous and ferric form of the iron by this test. So if in place of 0.05 ml of potassium ferricyanide, 0.05 ml of potassium ferrocyanide solution is used and deep blue precipitates, then it indicates the presence of ferric iron. I would like to share a case of iron poisoning with you. When I was performing the duty in the postmortem center, a body of young female was brought with a history of the iron poisoning. The history told that a young female of about 16 years studying in class 12 consumed the government supplied iron and folic acid tablets in the quantity of about 60 to 70 tablets that contains the 20 milligram of the elemental iron and 50 micrograms of the folic acid in each tablet with intention to commit the suicide. So overall, total iron concentration in the body of that girl was around 12 to 13 grams. She expired almost a week later of her consumption. At the autopsy, she presented with all the stages of iron poisoning, from the GI bleeding to the fulminant liver failure, as well as the intestinal obstruction and the necrosis. I will be talking details of the clinical features in case of iron poisoning when discussing metallic poisoning. The important facts here to mention is that when we sent the viscera for the toxicological analysis, then toxicologists in forensic science laboratories were not able to answer the nature of the poisoning. As iron is also normally present in the human body, and at that time in that laboratory, quantification of the iron sample was not the feasible. So it is important to note here that where any substance that is normally constituent of the body, only quantification of the substance can prove its toxicity. So as I told you earlier only, that the confirmatory test of the poisoning is the presence of a particular toxic dose of a chemical in the blood sample of the patient. So this was about the color test for the iron. Then, as we discussed different color tests, similar to it, there is a long list of color tests that is performed for different types of drugs and poisons. Some of the other important tests are shown in this table. One is the Marquis test that is done for opium and its derivatives. In this test, add a mixture of 3 ml concentrated sulfuric acid and 3 drops of formalin to gastric fluid. A purple color which gradually turns blue gives the positive for opium compound. Then Lee-Jones test that is done for the cyanide, where a greenish blue color that indicates the cyanide, while the purple color indicates the salicylates in the sample. This is the methodology for the performance of the test. I will not read all the methodologies because this is a long list of the poisons that has to be covered. I will share the list of the color tests that has been devised by the WHO under the Analytical Toxicology guidelines that you can find in the reference section. Then one of the interesting tests for the metallic poison is the Reinsch test. Here in the 20 ml of the stomach content or urine that is placed in the conical flask along with the 10 ml of the HCl and a small strip of copper. This is gently heated for an hour in a boiling water with a bath inside fume cupboard. The copper is then removed and examined for the deposition of any material. A silvery deposit indicates the mercury compound, while a black deposit indicates the arsenic or bismuth, and the purplish black deposit indicates the antimony compound. Then the Meixner test. This is done for the mushroom poisoning that contains the amatoxins. Under this test, dilute the sample with methanol, centrifuge and filter it, and add a drop or two to a piece of newspaper. Encircle the spot with a pencil and dry it. Add a few drops of concentrated HCl to the spot. If blue color forms within a few minutes, it is indicative of presence of amatoxin that is present in most toxic mushrooms. Then qualitative desferrioxamine color test that is indicative for the iron poisoning. In this, about 2 ml of gastric fluid, 2 drops of 30% of hydrogen peroxide are placed in 2 plastic tubes. 5 ml of desferrioxamine solution is placed in 1 tube and the resulting color change is compared with the other tube. If an orange or red color develops, it indicates the presence of toxic level of iron. Then isonitrile test is done for the carbon tetrachloride, chlorohydrate, chloroform, methyl bromide or any other chlorinated hydrocarbons. Under this test, the development of fall odor is perceived that is indicative of any of these compounds. Then tensilon test or the hydrophonium challenge test. Basically, this is not a color test, but this is the bedside test that is done to rule out the botulinum toxin. Under this test, when 10 mg of hydrophonium is given intravenously in a case of sudden paralysis, there will be dramatic recovery if it is due to myasthenia gravis, while a case of poisoning like with the botulism will not show any improvement. Melger's test is again done to look for the mushroom poisoning. Here the spore obtained from the mushroom are stained with 1 drop of Melger's reagent that contains the potassium iodide, water, iodine and chlorohydrate, and they are viewed under the microscope. Spores of Amanita phalloides and a few other deadly mushrooms will show a bluish black color that is called amyloid reaction, and that indicates the poisonous mushrooms. Then ferric chloride test is done to look for the phenol, phenothiazines, phenylbutazone, oxyphenbutazone and salicylates. A persistent purple color with the ferric chloride solution in the urine indicates the positive result. Then there is a long list of such type of tests. I will be sharing a list of color tests in the reference section, particularly mentioned in the basic analytical toxicology published by the World Health Organization, so that you can take the reference of it. In this way, we can understand how color tests are performed, as they are quick to perform and not much skill is required, so it is an advantage to perform them bedside and help in the clinical management of the poisoning cases. Also, at the analytical toxicology laboratories, these tests are performed before doing any or performing any analytical test to decide the group of compounds present in the test samples, as well as to rule out or narrow down the test required for the analysis of the test sample. This is all for today. Thank you.